Hey, how's it going, everybody? It's Ryan Saplin here, fat loss strength coach. Going to go over a glute medius strengthening exercise. Actually, this is me just messing around, learning how to improve my hip internal rotation because I do have a lot of restriction in the hip. And I thought I'd talk to you a little bit about like kind of what's going on and what I'm trying to do here. Maybe you can use it with your clients, or you could do it yourself. And what I'm doing is I'm basically mostly strengthening and activating my gluteus medius while going to hip internal rotation. Now, some people might say this is not good for you. I'm just simply experimenting, and you can try it to let me know if it's effective for you. But the idea is you are having to contract your TFL. It's that front little triangular muscle at the front of the hip that when you go up, it's going to cause the knee to turn in. Actually, what's interesting about the TFL is that it actually causes internal and external rotation and flexion. So it's actually pretty complicated if you think about it. But essentially, when you do this, what I'm trying to do anyway, is I'm trying to get the muscles to all work together, trying to teach a new pattern of activation, of movement. This is obviously an isolated motion. And I'm just trying to find my restriction. My left side is a little bit looser than my right, but you probably can't really tell the difference. I mean, it looks stiff regardless. So essentially, like again, I'm using the weight of my foot, in this case my left foot, as a weight. So if the more I kind of keep it at 90 degrees or perpendicular to my thigh, or to my body I should say, the more resistance I'm going to get with internal rotation. And that's again activating the TFL for internal rotation. And as my knee goes up, abduction, abduction, that's the gluteus medius that's activating to move the knee away from my midline, right? So looking from the backside here, you can see how I'm flexed. I'm actually palpitating my glute medius, and you can kind of see my foot, see how I'm going into internal rotation. That's the knee turning inwards. And just trying to get the muscles to function and work well together because, again, all the muscles of the hip are really complicated. And although we're taught like things like hip flexor stretch and piriformis stretch and foam rolling and stuff, I think, actually I do know this for a fact, a lot of things are just more complicated than what most people are willing to like exactly learn, unless you're watching this video because you happen to be someone that looked up hip internal rotation. Or maybe there'll be the word glutes in here as well because we are activating the gluteus medius as well. But remember, even if you activate the gluteus medius, you're still using the glute max. So you're still using everything. It's just a matter of like trying to overpower the dominant muscles. Anyways, I hope you enjoyed this video. If you have any questions, please leave a comment in the description or below the description. Click the thumbs up button. If you have any questions or special requests for videos, let me know. And I make a video every single day. Anyways, looking forward to talking to you or talking in the comments. I'll see you guys all on the next video.